So thanks everyone for joining us. This webinar is about the impact of COVID-19 on the Global South, an issue that we feel has not been sufficiently highlighted in mainstream media. And so we wanted to start a discussion on our platform, and hopefully this will just be the first one of many, maybe different formats, but we want to keep this discussion alive. We brought some excellent speakers to kick this off, and without further ado, I'll present Rabbi Micha Odenheimer, who I assume everyone knows. Micha is a rabbi, a writer, a journalist, social activist, a founder, a director of Tevel B'Tzedek. Well, founder, not director anymore.
I was a director, but now you're the director.
Excellent soup cook. So Micha, take it away.
Okay, thank you, Jonathan. And thank you to my dear panelists who've agreed to come. And especially I'm so excited. Yeah, I'm so excited to see everyone, and also tickled that Ruth Messenger is here with us. Very special. And everyone, Eliza and Avinash, and hopefully Lazar will be here too. And hi to everyone who's out there. So COVID-19 has underlined for us how interconnected we all are. We've seen how a virus can rapidly reach every single corner of the world. And we've also seen that we're capable of stopping the world, capable of stopping the global economy on a dime. And that, with all the terrible news of COVID, that also gives me some hope that we are capable also of thinking together about the common good. And the interconnectedness that we've seen means that we must think about the common good. The Global South includes places where there is still a large and very vulnerable population of subsistence farming villages and people living in urban slums. Over the past 40 years, there's been a push on the part of the United States and Europe to integrate the Global South into the globalization process, often through intense pressure. Much of manufacturing has been moved out of Europe and the United States in order to take advantage of the low cost of labor in the Global South. We've twisted the arm of many Global South countries in order to create good terms for foreign investment and to produce commodities primarily for the international market instead of for the food security of the country's own local population. The crisis of Corona has exposed the dark side of this kind of globalization, meaning that those countries are meshed and dependent on the global economy who are sufferers. A couple of examples. My first example is remittances. Remittances means the money being sent by migrant workers from poor countries who are working in richer countries, the money they send back to their native land. When I teach globalization in Kathmandu, I often know, what is Nepal's biggest global export? The answer is people. It's 6 million population working at one time. This is in India and up to 2 million in the Gulf states and Malaysia. Most of these workers are from subsistence farming villages that are not growing enough food to feed themselves. And they themselves are often illiterate and unskilled, at least in of Westals, and therefore they're very easy to traffic. Those to the Gulf states and Malaysia must pay large fees to manpower agencies to get work, usually selling part of their ancestral land and also borrowing money to do so. The money they send back is enough to help sustain their families, but little more. 28% of Nepal's GNP is from remittances, but in the villages, it is a 5%. The absence of many young able men and women from the villages further degrades these villages' agricultural capacity. Although there are many reasons why these subsistence farming villages are to produce enough food to feed their population for the whole year, a significant part of the reason is the economic agreements that the International Monetary Fund pushed Nepal into, forcing it to cut its budget in health, education, and agricultural aid to small farmers so as to create a better tax environment for international investors. In other words, slash the budget so there's less taxes. This helped to push towards a civil war that made the rural areas increasingly dangerous and pushed Nepalis to seek work elsewhere. Now, what happened in COVID? First of all, there was a streak down in India. 1 million Nepalis who had no place to shelter and had lost their jobs started walking home. Many of them ended up on the border of Nepal and had to wait for weeks to be let in. In the Gulf countries, hundreds of thousands of workers who were more vulnerable to corona because they lived in dormitories with dozens of their co-workers were isolated in camps with very little money or food and precious little access to medical treatment and slated for deportation. The Nepali government has already rescued about 200,000 of these, meaning paid for their flights back, and there may be up to another 300,000 that need to be repatriated. All in all, some 30% of Nepal migrant workers lost their jobs. Most of these were unskilled labor from the villages. So right now it's monsoon season. Many of the returning workers are helping to plant rice. It's very intensive work. Although many did sell their land, and others, their land remained untilled for several years, and it's harder to use. But still, they're working in the monsoon. Also, the fertilizer, which mostly comes from India, has been unavailable because of the lockdown. But in the coming months after the monsoon, it's going to be a harder situation. Millions may face malnourishment and malnutrition. And Nepal was just starting to rise up in terms of economics. It was really a better period now. Besides Nepal and Bangladesh, Philippines, India, Sri Lanka, Nigeria, many are dependent on remittances. All in all, somewhere between $550 and $700 billion flow into the global south in the form of remittances. It's estimated that this will be reduced by at least 20% in 2020 because of Corona. And in the villages, in the poor villages, and in the urban slums, it's going to be even more because the remittances include money being sent from the United States, Europe, and Australia to more middle-class families in the cities. So now the second example I'd like to give of how those countries who are more enmeshed in globalization are being hit harder by COVID is garments. Bangladesh make up 80% of Bangladesh's exports. 4 million people, most women, working as seamstresses in this industry in Bangladesh, support several other members with their work. Starting wages are about $90 a month. We're talking about living on wages month to month, not much to save there. About 8 years ago, horrific accidents exposed the dangerous working conditions of Bangladeshi garment workers. The first in December 2012 was the Tanzim fashion fire, which killed about 112 women in a Triangle Shirtwaist factory in New York City almost exactly 100 years before, in which 145 women died. Then in April 2013, 5 months later, the Rana Plaza, which included 5 garment factories, collapsed. 1,132 women were killed and another 2,500 injured. Since then, there have been improvements in safety and insurance requirements for factory owned, and retail stores in Europe, which mainly exports, took a huge hit. Many stores closed because of the lockdown and the economic uncertainty. Companies canceled 3.1 just to Bangladesh. 72% of the companies refused to pay even for the raw materials that had already been used and refused to pay for production costs that had been made but not yet shipped. Some responsible companies did pay, including H&M, that's the one I recognize, and 1 million people, mostly women, lost their jobs completely and were put on furlough. There's a similar situation in Cambodia, India, the Philippines, and Myanmar. In the great majority of cases, families have no savings or recourse, and the impact is felt in less nutrition for family members, including children. It means skipping meals, having 1 meal a day instead of 2, for example. For a long time, we at Tevel have been arguing that although globalization can at times provide jobs, the poorest populations are often majority are often left very vulnerable. These families need work to feed themselves at the most, to pay low wages, because there's no, there's no other alternative for them, and there hasn't been an investment in developing the country in a way where they could feed themselves. We believe that governments must put much more effort in terms of knowledge, finance, and capacity building into helping subsistence farmers become small-scale commercial farmers and grow enough healthy and inexpensive food to feed their countries. Strategies must be found to funnel money into agricultural or other economic development for the villages. For example, there should have been an easy way for the remittances part of the remittances to go into investment in those very villages where the people came from, and there weren't the financial instruments. Mostly the people working in the Gulf states and Malaysia, they weren't even allowed to open bank accounts. So it's very hard to make transfers, and nobody really thought about it and really cared. Let's also remember that zoonotic pandemics like COVID often begin when desperation pushes impoverished villagers into eating or trading in wild animals. So this is something that should concern all of us. It should concern all of us anyway, just because we have hearts and because we know that the world is one. But it also has to do really with our health and with the cause of the next pandemic, God forbid. Even before we prioritize global trade, we must also return to the value of self-reliance and to free poor populations from the vicissitudes of the global market for their sake and for ours. So that's what I wanted to say.
Thank you, Micha. Are there any questions for Micha? Micha, can you say which countries are suffering most from this issue of harming, like reduced remittances?
Right. So Nepal, of course, Bangladesh, very much also, along with the problem with the garment industry, the Philippines, Sri Lanka, in Africa, Nigeria has a lot of workers working on remittances. And I think there are a lot of other countries, but those are the ones that jump out in my mind.
Thank you. Jonathan Wolf, you had a question, or should I read it for you?
You have to unmute yourself, Jonathan, if you want to ask. You're muted. You have to unmute yourself. Can someone unmute Jonathan?
Sorry. What can we
There you
do
go.
to ease this crisis of remittances, which the virus is so tremendously exacerbated?
What can we do? I think right now, first of all, there just has to be aid. There has to be, a kind of Yangish, just payments to families, just transfers of money. That's first of all, I think. And second of all, there has to be, I think, investment in these rural villages and in helping them transfer to commercial agriculture. One of the things that happened because of the IMF strategic adjustment agreements that were pushed on a lot of countries in the 80s and 90s was that they cut agricultural extension, meaning officers would go out there and really help the villagers keep up to date in terms of agriculture. So programs like that have to start again. Not only extension, but also helping with finance. And people are talking about it. Now they're talking about it in Nepal, they're talking about it like crazy all over.
Which NGOs are working effectively on this? I know Table Tzedek, I know AJWS, which Ruth brilliantly ran for years. What other Jewish and general NGOs are doing what the governments and corporations should have been doing?
I think Gabriel Project also is involved in Mumbai area with villages. But we're all on, I mean, people like us, I'm not saying about Ruth is much larger, but we're small scale. And I think that things like this, that now it has to be also governments. We have to push governments to take responsibility. It's also creating financial instruments for, in other words, where people can easily save and invest in their home village and get money from the government to supplement when they come back. They have something that they can grow. Yeah.
Any other questions for Micha, or we're moving on to Ruth's talk? Any other questions? So we'll circle back, Micha, at the end.
Okay.
So Ruth Messenger was president of American Jewish World Service from 1998 to July of 2016, and is currently their organization's inaugural global ambassador. In this role, Ruth is continuing her crucial work of engaging rabbis and interfaith leaders to speak out on behalf of oppressed and persecuted communities worldwide. Ruth doesn't really need an introduction.
Thank you. Let me just get started, because I have a lot to say in 10 minutes, hoping to get to a little bit of a slideshow as well. But I want to first add to what Micha was talking about. So Jonathan, 2 points. First of all, in terms of growth between 2000 and 2020, the dollar amount of remittances just to Africa grew from $4.8 billion to $48 billion. So as immigrants have made their way and been successful, one of the major things they do is send money home, which becomes a source of support. It is indeed, as Micha said, what government should do, but it's actually what people are doing. Now, one interesting side note on that, and that is that, which we're not talking about today, but America is handling its COVID responses so badly that a big group of people that we are calling excluded workers are immigrants who, because of their immigrant status, lost their jobs and didn't get the United States so-called stimulus to everybody. So precisely the people who were sending home money out of no money now have no money. They don't have jobs and they don't have the US stimulus, so they can't send remittances. So it just exacerbates the problem. I want to try to talk very briefly to health, economic, social, and political ramifications of COVID-19 in the developing world, and then talk a little bit about what AJWS is doing, but I will run out of time. I think it is astounding that our newspapers in the US, I don't know about Israel, but here are so consumed with terrible responses to COVID here that they never talk about the rest of the world. So this is an audience that doesn't actually need reminding, but we're talking about a world which more or less doesn't have sophisticated medical equipment. That's obvious. What's not so obvious is that in most of the communities where many of us work, they don't have access to clean water. Sometimes they don't have access to any water. They don't have access to soap or hygiene products. The ways in which they live make this notion of social distancing impossible. And there are limits on mechanisms for massive public education. So the likelihood, I'm sorry to be the person saying this out loud, but the likelihood of massive and rapid spread of this virus in many of these countries is probably just beginning. We're seeing it, for example, in the camps, the Rohingya camps in Bangladesh. And we know it because the refugees and immigrants, as Diana would be happy to say, are increasingly the marginalized population at the edge. Now, I want to mention very briefly, though, another health consequence, and that is also seen in the United States, but dramatically it's going to be in the rest of the world. Every other health issue is being neglected. So countries struggling to do something about this virus are stopping measles inoculations. They're stopping other kinds of basic health care. There's the story in the New York Times today about Britain not doing any non-essential operations, and they supposedly have a healthcare service. So things that are explosive and deadly in the countries where all of us work are now going to re-explode and cause infinite number of new deaths. Moving on very quickly to the notion of economic consequences. Again, we're talking about people who do not live the way most of us live. They have to be able to go to market every day in order to get some food. They have to be able to take something to barter to be able to feed their families. But because they are themselves ill and so can't move, because there are rules against being out and about, and I'm going to say more about that in 1 minute, because social structures are deteriorating in countries where large numbers of people are getting sick, it is extremely likely that at least in some of the countries that I know well, the deaths from hunger will actually outpace the deaths from corona. And I just want to add a quick note to that. In some of these countries, this is really moving on to my next issue, but in some of these countries, I'll be interested to hear the report today from India, but in some of these countries, the crackdown efforts, which we, of course, encourage all over America, and we can't get half our states to do mask wearing and to enforce social distancing. But in many countries, the crackdown efforts, either intentionally or unintentionally, and we have to debate that, are being laid out in a way that makes marginal populations more vulnerable. So if you say that people can't go to market, then the people who are at the marginal edges by virtue of color, by virtue of tribe, by virtue of religion, by virtue of sexual orientation, who were less able to get jobs, less supported by their governments, less able to get quick access to help, are going to be the people who are most hurt by the lockdown measures. And that in and of itself will again exacerbate the numbers of deaths. So that brings me to the social and political ramifications of the pandemic. So the fact is that as we now see in the United States, where we could have seen this every single day of our lives, but we see it very clearly that certain populations are more hurt than others, that Black and brown populations are getting sick sooner and dying more often because of a variety of social and economic conditions. That's going to happen, I would say, with even more intensity in other countries around the world. In Thailand, for example, where there is a government response and some help, there are significant populations that are being left out of getting any help at all, which is part of what AJWS is trying to respond to. But I think the broader issue here is economic health problems directly, health problems secondarily, economic consequences, and then social and political consequences that require those of us who help and work in these countries to take a hard look at what's going on. I wanted to note before I talked about measles, I do want to note that the World Health Organization, which now the United States has decided to see if it can destroy, but you should know that the World Health Organization has reported a huge spread again of Ebola in the Congo. It's just another example of conditions that quickly are getting out of control. And in Bangladesh, which I mentioned briefly, we have designated information, I'm sure this is true in other countries, that people who are sick will not go to the hospital because they don't trust the healthcare system. So virtually every aspect of healthcare, the economics of healthcare and the political ramifications of healthcare are going to be exaggerated in these countries, country by country. So what I want to do now is talk a little bit about what AJWS has done, because I think we are correctly proud of what we've done. And because, and this goes to the last debate between Mika and Jonathan, one of the things we're going to see is that organizations, whether the AJWS size or TEBL size or whatever size, are better able to respond quickly and do what's actually needed than our massive government efforts, which is too bad. I think the World Health Organization does understand that, but we're very seriously working on the US on defunding the World Health Organization. So I have a bunch of slides. If somebody can pull them up, I'm going to go through them very quickly. And if they're not quickly accessible, that's okay. There they are. Okay, so you can all read, so you don't need me to read you the PowerPoint. That's exactly, those 3 points are what I just talked about. Can I click these to keep going? No, just keep going. Next slide.
Ruth, 2.5 minutes.
Okay, good. So here are countries where you see a quick set of examples of the problems that we're dealing with that are social and economic, that are hunger, that are marginalized populations. Next slide. Next slide. I want to take you through these. You don't need to read all of these. We are keep going the slides. We are looking for things to do where our partners have told us what's most critical, where we are looking, as you heard me say before, at marginalized communities, but trying to build up their resilience. Next slide. All the countries where we work, 19 countries, we are using both some of our regular $15 million a year in grant making to help with COVID-related issues, and we have raised a little over $3 million to keep doing COVID work. Keep going on the slides. Those are our priorities. You know this long time from AJWS, and the most marginalized populations. Keep going. Now, these are what we're funding them to do. This is what's more important. So the immediate needs of marginalized communities, because their capacity, building their resistance so that they will be more sustainable after COVID, looking at the ways to get out key information that is essential to people's health and human rights, and looking at ways to hold governments accountable and responsive to the needs of those communities. Since I'm about to run out of time, I'm just going to give you some quick report on Guatemala as one example. This is the country I've been in most recently. So going back to all the points I made to you before, hospitals are totally ill-equipped. There are severe water shortages. Many families can no longer afford food. The government lockdown, the first step the government took was to suspend public transportation. So that, of course, exacerbated every existing problem and made the most vulnerable people in the country the biggest target for these problems. We have, as an example, an NGO there that is probably doing the most possible to spread public health information, encouraging other people to protest to the government for its lack of support. One person was quoted, I thought I might just end with this: "They killed me because the food aid never came. It wasn't the coronavirus, it was the state. I was a doctor, I never had a mask or protective equipment. It wasn't the coronavirus, it was the state." So our efforts from AJWS are hand in glove to also do the essential resilience building, right structures, and holding of governments accountable, so that countries will be more able to deal with what Mika described as, God forbid, the next virus. I'm just going to describe as an ongoing series of pandemic and health problems that we are so ill-equipped to deal with. Thank you.
Thank you, Ruth. And only 20 seconds late. Perfect timing.
Pretty good. That's pretty good for me.
That's pretty good. Questions for Ruth? Well, I was going to ask Ruth. You mentioned early on that we're getting very little attention for these issues in northern media, Western media. What do you think would take to activate public attention to these issues right now?
Having a president and a prime minister, both of those would help. Sorry. I mean, I just think that that's true, that we're in a situation in which we turn out in so many ways, I'll just speak for the US, to be ill prepared for this and kind of wishing it over. And to go back to Mika's earliest point about globalization, of course, were we to end up being successful in the US, and it's clearly going to take, frankly and sadly, a lot more time and a lot more sick and dying and dead people before we get to whatever is beyond this phase. I'm not sure really where we're headed right now, but we're so consumed with all of that that we're kind of pretending in a worse way than usual that the rest of the world doesn't exist. And by the time we, let's say, get to some better place or platform with regard to COVID in the US, because it is a global world, it will keep starting up again. You know, we saw this to some small degree. Those of us who are as old as I am actually went through this with HIV/AIDS, in which it took a long time and a lot of energy to convince people that a disease that's spread by, among other things, by sexual encounter doesn't just stop because you direct it to stop. And if you're not addressing it in every part of the population and eventually in every part of the world, then it will continue to spread. On the COVID issue, we're doing nothing like that. I know just the last thing I would say about that is just referring to HIV/AIDS. It was George Bush, those of us who are passionate Democrats keep reminding everybody that it actually was George Bush that passed PEPFAR, which was the World AIDS Program that made a huge difference in the developing world. We are so far from the capacity to do anything like that now. We have a vice president who is affirmatively undoing human rights all over the world with his new Human Rights Commission. So the answer is the only positive answer I would give to you, Jonathan, is the media should be doing this in a huge way. I think the media is really trying to cover what's going on in the US with COVID, what's going on in the US politically, but they actually owe it to everybody to say that the dimensions of this pandemic in countries around the world are really almost unfathomable because of what Mika said about remittances, because of what I said about healthcare, because of what the state of the governments are. And we need some ways to bring that to American public attention that are way beyond what I can do. Or what Robert Bank, who is the distinguished CEO of American Jewish World Service, can do. So.
Thank you. Gail, you had a question. Gail Schorsch. You might be muted, Gail.
Hi there. Thank you so much for presenting. My question is anybody tracking the data that both of you have referred to on the projected death and loss in the Global South and somehow using that data to bring attention to these issues?
I think, first of all, the World Health Organization is tracking this very well. They were quoted recently in, just trying to look this up very quickly, the chief of the World Health Organization said that is keeping track of every country and said that public health guidelines are not being followed, and around the world the crisis is going to get worse and worse and worse. And the other thing, although I can't remember the website, is that starting 4 months ago or 5 months ago, if we can all remember back that far, there's some kid, I think he's literally 14, who started a website that does something, I don't even understand what I'm saying, but does something called scrubbing all the data that's put out by any country, any place in the world about the impact of the pandemic, and he collects it all. And somebody can find that website, and he keeps it up to date. And because of what scrubbing is, which I don't understand, it keeps itself automatically up to date, but it reports incidents and numbers all over the world. It's amazing.
Could I just also mention another thing in terms of the reporting is that, and when you're talking about the Global South and the toll of COVID, as I don't remember if it was Ruth or Micha that mentioned, then there's two dangers. There's, I think it was Ruth, the health danger, and then there's the danger from hunger, from these situations. And so the Food and Agriculture Organization has been tracking very closely, along with IFPRI, which is a Food Policy Research Institute, about how the COVID pandemic is affecting food security around the world. And affecting global poverty levels as well as another thing that's monitored. And so like within the Global South and within the international development sphere, there's actually three sets of that are being very closely tracked. So one actually has to do with health, one has to do with poverty, and one has to do with hunger. And all three of them, there's very, very close monitoring being done on a country level and also on a sub-country level.
I work with a young woman in Kenya who runs a foundation that she started to give scholarships to Kenyan high school students to stay in school. But she had reported 3 months ago that from her population, which is not big, but reasonably typical, there's no question but that more people will die of hunger. So I just take that as really serious. She knows the families, she knows where they go every day. I suspect, although I know he will hear this soon, that is a huge issue in India. But yes, it's all being kept track of. Thank you, Elisa. That's helpful. And somebody posted the website that I was talking about. So
thank you.
I think Joanne Moore, who always
thank you, Joanne and Nissan. Yeah.
Thank you. Thank you,
Thank
Joanne.
you, Ruth, for a powerful talk. Next up is actually from IFPRI, Dr. Avinash Kishori. Dr. Avinash is a senior research fellow at the International Food Policy Research Institute. Dr. Kishori received his PhD in public policy from Harvard University and master's in public affairs from Princeton before joining the PhD program. Avinash studied at IRMA and worked for 4 years with International Water Management Institute before going to the US for higher studies. Avinash is interested in agriculture, environment, and development economics. At the International Food Policy Research Institute, he works on projects that seek to bridge the gap between laboratories and farms in Indian agriculture, using action research in collaboration with agricultural universities, agribusiness firms, and farmers. Dr. Kishori, take it away.
Thank you. Thanks a lot. Thanks a lot for this opportunity. I will talk about food, but also about a couple of other issues that COVID has affected. So as many of you know, already the detected cases in India has crossed 1 million. And in next 10 days at current rate, it will cross 1.5 million. And I would emphasize the word detected. I come from one of the poorest parts of India. It's a state called Bihar, where what they're finding is that the testing rates are very low, while when they're testing, the positivity rates are high. So what has happened is COVID started from more globalized, more commercialized areas of India like Kerala or Delhi and Mumbai. But once the workers returned, that Mika was talking about earlier, it has now gone to the hinterland where the health systems are quite weak. The community spread has firmly set in. So that's there. Our curve is still quite steep. Almost as steep as US, and I think the difference in the slope is mainly because we are not doing as many tests per million population as the US is doing. Some of the big cities like Delhi, for example, concerted action has taken place and the number of new cases is coming down consistently over the last month. But in the hinterland, in the other states, poorer states of India, it's on the rise. Many of you talked about the health issues. And I do think that today, Mumbai municipality, today or yesterday, they released the number of deaths during this period. And if you compare to the number of deaths last year, there has been a lot of excess deaths that are not attributed to COVID. So people are dying of other causes too. We don't know exactly what causes. And unfortunately, Mumbai released this data. Not every state or large city of India would release this data. And not every city or state has this kind of data management system. So we will see a lot of excess deaths. So for example, my hometown, Muzaffarpur, the main charitable hospital where babies get delivered has been locked down because a lot of doctors are catching COVID. And this is happening in public health centers in rural areas, etc. too. So discontinuation of vaccination. India has been investing a lot of efforts to increase the institutional delivery, because institutional deliveries, when you deliver your baby under a trained hand, etc., then the mother's mortality and the infants, the newborn's mortality goes down. And 10 years, 15 years of effort has gone into increasing the number of institutional delivery or delivery under the eyes of trained workers. That would have gone down. It's my guess. I don't have real number. So I think health discontinued. As India also has large school feeding program for poor kids who go to public schools, government schools. They get their meal there. Now, in the number of states, those have been discontinued because the schools are closed down, right? And similarly, we have for very young kids, there are things called take-home rations. They come to these creches and then they're going home, their moms or they take rations with them, like food rations, which is an important part of their daily consumption. And those would have gone down too, because not every state has managed to get them delivered to homes. There is some effort going on, but it will take a while before every state manages to deliver those things. So yes, there will be a lot of health damages. On the hunger and hunger-related issues, my own reading of the situation is that there won't be as big a calorie deficiency as there would be nutrient deficiency. So Government of India, one of the things that is working for India in COVID is we had overflowing granaries of rice and wheat, and we have extended free delivery of those for a large section of our population up to November. So sheer calorie deficiency should not be as big a problem. And I'll be surprised if there are hunger deaths, except in really marginalized communities in really remote corners. But there will be a big decline in nutritional intakes, fruits, vegetables, things that we want everyone to take. I think those would go down. But I think one of the biggest problems that we are already starting seeing is, apart from the disease itself, is the loss of jobs and the associated loss of income. Huge loss of jobs. India already unemployment was high before COVID set in, and during the lockdown period, it went up to 25%, which is unheard of. In India, 6-7% unemployment is considered record and high. It has covered a lot, but you would think that the informal jobs and casual jobs that dominate Indian job scene, they would suffer more. But actually what has happened is salaried jobs. So There were around 50 million people in India before the COVID started were in salaried jobs, and reported losses were 17, 18 million. Only 4 million jobs have come back. Casual workers and really small businessmen, wherever they had the opportunity or restrictions were withdrawn, they were able to get to work again. But salaried classes have lost their jobs and are uncertain about salary cuts, pay cuts, etc. I'm not saying that the casual workers and others are in a very good situation. They are not. India has world's largest workfare program, where in rural areas, if you are willing to do physical work at minimum wage set by the government of India, then government is bound to guarantee you that job. That program has been ramped up massively. There has been a 50% increase in number of people getting those jobs for small amounts of money. So there are some programs out there to support rural areas. Another thing that is working in this time is the weather gods have been kind. So the winter harvests were very good. And right now, Kharif, the monsoon sowing and transplanting of rice and other crops is going on. Rains have been by and large good. Barring West Bengal, where we had a cyclone, and Assam, where we had floods. We have floods actually as of now. Weather has been nice, and that has helped. So farm sector employment has actually gone up. But one thing that has happened is when India has one of the world's lowest female labor force participation. It's like almost as low. Only Pakistan and some of the Middle Eastern countries have it lower. Even Bangladesh has higher female labor force participation. Whenever unemployment goes up in India, even the few women who are in jobs, they get pushed out of the job market. So even a lot of women who work, agriculture is the main place where they work as agricultural labor, paddy transplanting, etc. My sense, I don't have ready-made data like recent data, they would have been pushed out of the job markets too. So this crisis would be terrible for women for two reasons. One, the few who were earning anything are not earning. Then even their men are not making money. The men are not making money. And I think there are already reports that intimate partner violence and violence against women and girls, it doesn't get reported as much, but they would have gone up for multiple reasons, including stress induced by this crisis. A lot of migrant workers had to go back to their villages. They're there, they are without their money, they are resource constrained. Anyway, the relationships are nowhere near equal. So that's another thing which would put enormous psychological stress on women and to some extent children. One another point that I want to make is that normally India has a lot of welfare programs that support the poor, but the welfare program designs are not flexible enough to help transient. And what this crisis has done is it pushed millions upon millions, and we do not have the right estimate, into transient poverty, including in urban areas. So two things. One is even in rural areas that have been were not poor, but at least temporarily have been pushed into poverty, we do not have adequate support mechanisms for that. Urban areas, because their poverty in normal circumstances is mostly a rural phenomenon. There are urban poor too, millions of them actually, but more poor are there in rural areas. So most of India's welfare programs focus on rural areas. The bulk of them focus on rural areas, like this employment guarantee, not there in urban area. It's for rural area. Or free ration, 75% rural households qualify for it, only 50% in urban. So a lot of urban people who have been pushed into poverty, they do not have enough to lean on. And when I looked at the past data on other crises like India in 2016 demonetized all its high currency notes or other slowdowns, you see that whenever someone in a family loses jobs, the consumption decline is smaller in rural areas than in urban areas, because in rural areas you have social network, etc. They may be exploitative, but they at least support you in the time of need. In urban areas, many of you are like many of the people are migrants. They do not have rich social networks. They do not have bank accounts and other issues. So urban areas also the problem would be quite serious, and the support is not adequate. So I think loss of jobs, loss of incomes. The last point that I would make is, since many people are worried about whether they'll get their next month's salary or not, and 100% of the salary or not, so people are economizing on purchase of everything but not. So except for staples and data, whose consumption has gone up. Basically, I have friends, I am an MBA also, so I have a lot of friends in retail sector, etc. Retail sales have gone down, even for food retail, like non-food items, personal care, and a bunch of other things. The second is food service industry, restaurants, hotels. India has a huge wedding market. Indian weddings are famous for their scale, etc. all of that has come to a stop. 7-8 million people are working in this sector. A lot of high value food products get sold and other services also. All of that has come to a stop, and that will hurt many people. And since people are not buying or economizing on whatever they can economize on, I mean, if everyone starts saving, it's a bad news for economy, right? That's what King told us, and you are seeing, and it may get worse. The last point is that a lot of enterprises in India, so for example, 70% of enterprises don't have bank accounts. 90% of them, the micro enterprises especially, that employ 100, 110 million people, do not even maintain balance sheets. If you look at governments of India's relief package, it's not outright cash transfer like US did. It's more on credit relief, etc. Now, commercial banks are already worried about loans going bad because the economy is in bad shape. They would not want to lend to an enterprise, small or large, that doesn't have collateral, that doesn't maintain a balance sheet, so you don't know whether they are creditworthy or not. And many of them didn't even have bank. So a lot of the agencies, they have already depleted their working capital. So even when restrictions go away, the disease subsides and demand starts picking up, they will struggle, and the need for credit will be very, very high. And we will have to use some informal ways, or there's some small firms, Korean and others, that are using machine learning algorithm and AI to decide who is creditworthy and who is not, using non-balance sheet, non-financial data to assess your credit rating in a way. So those kind of innovations will be needed, and credit need would be very important once the subsides and demand starts reviving. Good thing with these agencies have, they're very small fixed costs. They're very lean operations. So if demand comes back, they can spring back to life, but they will need a little bit of support, a little bit of pump priming. I am worried that that's not happening because Government of India's programs are more credit linked and not outright cash transfer. Thank you. Thanks a lot.
Thank you, Dr. Kishore. Thank you. I know Micha has a question. Any other questions? You're welcome to write in the chat.
Okay, so I have actually two questions. First, I wanted to ask Avinash. We heard all over the world, I mean, we heard here in Israel that there was this very severe lockdown in India. And I was wondering what the people, the urban poor in the slums who were locked down in their own homes, and many of them are part of the informal economy. So they weren't getting any, any salaries or anything. How do they survive? That's my first question.
So I think they had a very difficult time, and you would have seen these videos and photos of these thousands of men simply walking back, even when their homes were 1,000 kilometers. My state sends a lot of migrants, UP and Bihar, Uttar Pradesh and Bihar, and it's 1,000 kilometers from Delhi, and people started walking to Delhi. Right? This girl became famous. She biked her old father on the backseat of the cycle all the way to Bihar, which is about 600 miles, 700 miles. So people faced very difficult times, but there are a lot of social organizations, plus some governments also, they did offer some support. But people did face I don't want to paper over it, they had very difficult times. The second thing is that they had some savings, some of them, small savings, which helped them tide over the first few days. And then these free kitchens, soup kitchens, etc., started, and that kind of helped. But they had very, very difficult time. They had an excruciating time, and it's embarrassing for every Indian in the way that we mistreated these workers. I have a maid who helps out get our housework, etc. And the way upper class Indians and the government, the insensitivity we showed to them, I do not have anything not much nice to report. It's just embarrassing for all of us who are better off. Yeah.
So that leads into my second question, which is, in the United States and in Israel, the performance of the government in terms of the response to COVID-19 is very controversial. Like, there are a lot of people in the United States who are very much think that Trump has done a terrible job. And in Israel now, there are demonstrations almost nightly against the Netanyahu government, much of it based on the fact that he's not handling this second wave well at all. And I wanted to ask you, what is the feeling in India about the government? Is there a consensus or a feeling that the government has handled it well?
So Mika, it's a very interesting question, yes, because the notes I had prepared, I didn't talk about that. I had a few points on what's working for India. And what has happened is India's current prime minister at the national level is extremely popular. And his popularity it's a Teflon titanium personality. As far as his popularity, nothing makes a dent in it. I hear that people are unhappy, especially the people who have lost jobs, etc. But there haven't been any massive protests, or there seems to be, I mean, in the people like me who would be like, I don't know, Democratic equivalent in the US, we are not very happy, but among the masses, people still think that this is the best that could be done. And we are lucky that we have this as a prime minister. I don't agree with that. But you'll be surprised how much rallying under the flag there is. So as the disease prolongs and the pain, economic pain becomes worse, then we may see a change in opinion, etc. But it's by and large been peaceful. People have gone through immense pain and excruciating trouble without revolting, rebelling, forget revolting, rebelling, even protesting. There haven't been any even medium scale protests that I know of. So that's one thing that has been, in a sense, going for India. Any other prime minister or government, you would have seen a lot more unrest, and which would have made things worse, actually. So yeah, the popularity of prime minister helps. Sorry, yeah.
Thank you. Thank you. Further questions for Dr. Kishoy? So we'll move on to Dr. Lazare Rukundwa Sebitereko. Dr. Rukundwa is a Humphrey Fellow at Penn State University Park and holds a PhD in theology from the University of Pretoria in South Africa. His many accomplishments include being the founder and president of Ebenezer University of Minembwe, located in the Democratic Republic of the Congo in Central Africa. He is also a professor of religious and community development studies in the DRC. Additionally, Rukundwa is a founding member of Burundi American International Academy, the paramedical school Kamenge in Burundi, and the Complexe Scolaire d'Application in Minembwe, DRC. Welcome, Dr. Rukundwa.
Thank you very much for giving me the opportunity to be with you and talk about the socio-economic impact of COVID in Africa. Of course, you will forgive me to be a bit brief because I can't talk of the whole continent in 10 minutes, but we'll just do some examples of a few countries. One of the things that I will start talking is that the confirmed cases right now are over 700,000. And we have about 15,000 deaths. And South Africa is one of the highest country affected with over 350,000 cases. And we also have Gambia, which is being the least with less than 100 cases confirmed. But according to researchers, they say that COVID is spreading very quickly and is over now 30%, grows about 30% in every week in the whole continent. So you see that is something, even if it started late, I would say, but now is moving very quickly. Probably one of the things I would say is that before there were no testing equipment, but now at least in many places they are, so they can know who is being infected. Now, I wanted to discuss some of the challenges that many of African countries are facing with COVID. One is about the unpreparedness in the riposte against COVID. One thing is that there was very limited knowledge about the pandemic. And secondly, there was a problem of lack of equipment. So the fact that people didn't know about it and didn't have equipment to test, so it was very much difficult to know who is sick and who is not. and even the education about it, even today, is still a very big challenge. And the other problem under that is that the drastic measures which were taken by governments, and to many of people think that there were no proper plans. And one of the things was like to take the decision about the lockdown, the confinement. And then you do it without any preparedness, any measures and preparation, because most of the people in Africa, especially in the rural areas, they live day to day. They live by whatever they can get in the market or in their field. So if they are being confined, it means that we will have so many people who will die of hunger and chronic diseases than COVID. So that was a big problem, and in many countries. And I think they had also all this pressure from Western countries, especially with World Health Organization wanting everything to be closed and so on. And we had two countries that refused to completely close their countries, especially Burundi and Tanzania. They said, well, if we close, then we are going to have so many people who will die of other diseases than COVID. And for Tanzania, the president said, if I close the borders and they close everything here, so we are not only going to be affected, to ourselves in the country, but think of other unlocked, other countries that are inland locked, like Burundi and Rwanda and Uganda, who don't have access to the sea and get all their raw materials or their goods. So if we close, then we are going not to die ourselves or to have problems ourselves, but we are also killing other neighboring countries. So that is one problem that we have. The second problem that I see is that with Africa is the lack of health care system to deal with such a pandemic. And of course, as some people have already talked, this is not the only problem that Africa might have has to deal with. Like the case of Congo, we are having Ebola, and which, of course, is somehow neglected, but which is making, killing people every day. And the fact that Congo, many of African countries don't have research capacities or health infrastructures that can has to deal with all these issues. So you find that when the pandemic comes, it makes a big, it becomes a big issue because we are not able to deal with it. And also countries are closed, borders are closed, airports are closed. Even to have specialists who can come from abroad is also very much limited. And even if you look at resources that are invested in health sectors, is very, very limited compared to the national budgets. So you find that it is a problem that has always been there. And when a problem like this comes, so it hurts more because little is invested in hospitals. There is also a problem of negligence of traditional medicine. So when people don't have ways to deal with, don't have access to modern medicine, they have also to turn to their traditional medicine. But it has been a big challenge that all the knowledge, all the traditional knowledge has not been used or has not been given that seriousness, so that within this kind, within such a context where people having a problem and the world is not knowing what to do. So you find that many African countries are just stranded, just waiting to hear what the West will say, or what the West will offer for them to survive or to be protected. So this has been a big issue in a way, and this you find it not only within the government sectors, but even within academics. At the university, many universities, you don't see that traditional ways of knowledge are also being promoted, so that they can also not only to be independent or use the knowledge that they have, but also they can contribute to the world issues. And currently, what we see is actually that herbal medicines are being used so much to treat cases of COVID or cases that are likely to be like COVID. So that has been also a problem that people have to deal with currently. Now, the infrastructures, when we come to the medical infrastructures, we are talking of hospitals and even staff. I was talking with a doctor who was telling me that you actually find that you have 1.8 beds to 1,000 patients. So which becomes a big problem. And also even you find that you have one doctor to almost 1,000 people. Again, it becomes so much difficult to deal with such a pandemic when it comes. So that is a big problem. The other thing which we see that has happened are the the measures of this is a point 3 that I will probably talk about, is the measures of confinement or the lockdown and its consequences in Africa. As I say, that these measures are taken hastily. So they have so many consequences on people. One is about the accentuation of poverty of people that live on daily labor. So everywhere you go, you find that people are locked. You are telling them to stay inside, but they don't have things to live on. And this has been not only in terms of small businesses, even big businesses. You find that there is a problem with schools and where some other places they used internet, but we have places like in rural areas where we don't have even internet. So those have been some of the problems. And the other thing which we see is about the impact on economy. Someone was talking about diaspora. Actually, it is said that over 20% of the annual remittances are completely cut down because they are not working where they are and they can't send anything at home. We have also countries that have been completely, affected, especially those that depend on exporting like oil, countries like Nigeria and Angola. This has been affected. You have countries like depend on air transportation, like Ethiopia, Kenya, Rwanda. They have really also been affected. You have countries that also depend on tourism, like Kenya, Tanzania. they are also very much affected. The other problem is about insecurity. Sorry?
We need to start finishing, so please move towards
I'm finishing. The other problem that we have is about also insecurity and human crisis in conflict zones. And here I will just give an example of Congo, where we have conflicts that are going on, and refugee camps, people in refugee camps, displaced camps, people in who live in rural areas, they have no way that they can live by themselves. So you find that even their support from humanitarian organizations is also reduced. So that is also a problem that we are having. And finally, you have also people like who are in rural areas, not even only in rural areas, even in urban cities. According to some reports, you have 34% of African cities have access to water. Now, all the rest don't have access to water. So infection is so much wide. And so the problems that we deal with currently are so much enormous. You have Ebola, you have malaria, you have TB, you have hunger, you have all the armed groups fighting and killings. So, and then you add Ebola. So it becomes so much difficult to deal with one problem. And finally, I would say that how do we come out of this situation? One, I say that we need to teach people how to live with this pandemic, because it is only by confinement that we can solve the problem. But I think people have to learn and teach people how to deal with the pandemic. Secondly, I think the governments have to help people with small businesses to recover their economies, and people can survive. I think I can end there.
Thank you very much, sir. I know Micha has a question. Anyone else? Let us know.
Okay, Lazar, thank you so much. I wanted to ask you, you know, again in the West, in Israel and the United States, on the internet, and there are so many conspiracy theories and so much distrust around this corona pandemic. And I wanted to ask you, how are people interpreting it in the areas of Africa that you're familiar with? What interpretation are they giving it? Is there hysteria around and fear? Is there any particular widespread beliefs around the coronavirus? Anyway, that's what I wanted to ask you about conspiracy theories, basically the interpretation of people, of what's going on.
Exactly. People here in Africa, generally, they are talking about it as if as a political pandemic, as much as they see it as a health issue, because it is connected with all the vaccines, they are talking about. So it is, they created it to crash, or to crash the world. So that is the most thing that is being said. And secondly, the way is being presented, it is coming with a full force of politics, where like the measures of confinement they are putting on. If you go out, they fine you. If they see you on the street, there are some countries actually people were shot and died because they saw them outside, and others because they are not putting on the mouth mask, the nose mask, and they are arrested and or they are arrested or shot. So you see that it's not only being looked as if it is just a health issue, but it is more political. And this is what people are carrying.
Mm, that's what I was, thought that might be.
Have you seen any way, Dr. Okunwa, any way that traditional, like local cultural perceptions or traditional and medical paradigms have been used to explain this pandemic instead of undermine it? In other words,
I'm sorry, I'm not getting you very well.
Have you seen any way in which traditional medical modules have been used, implemented, translated to better explain the pandemic? Have you seen anything like that?
Yes, and this is actually what is being largely used here, at least where I am. There are so many hubs that, medical hubs that are being used. Again, as I was saying, that there is no much seriousness in this research, but these are what people are using. So they go in the bush or around whatever hubs they use to treat them, because as they say, there is no treatment, and very few will go to the hospital. Like I don't have exact percentage of the people who go to the hospital when they are sick, but at least I know 70 or between 60 and 70 people, 70% rather use hubs than go to the hospital.
Interesting. Michalia had a question. Michalia? Michalia, you want to ask this out loud, or should I read it for you?
You have to unmute yourself, Michalia. You're muted.
I'm sorry, I don't know whether I'm not getting you very well.
Read the question.
We're waiting for a question. 1 second. Michalia?
Hello? Yeah.
No. Dr. Okunwa, 1 second. We're waiting for a question.
Okay.
Michalia, you're muted.
Why not just read the question?
Sure. So Michalia.
Here she is. Now she unmuted.
Hi, everyone. Hi, Doctor. Greetings from Joburg.
Oh.
I'm wondering what kind of insight you have into the stigma around how COVID is being dealt with in South African society, specifically in many of the communities. There's a lot of secrecy around getting tested, telling people that you've tested positive. People are, we just spoke to a colleague in Soweto. He says there's funerals every day and nobody says what anyone's dying of. There's a lot of shame around having been tested positive. And I'm wondering if that's the same in other African states. Have you seen similar social stigmas around COVID?
Well, that's a very good question. And I personally, last month, I did participate in the funeral of one person who died of corona. But unfortunately, it was not officially said so. But people around say that she had COVID, and her husband also was sick. As you know, in Africa, social gathering and is very, very much important, and person-to-person relationship is very well respected. So when we went to church, the priest refused to hold the memorial service in the church, but we did it outside, which was quite unusual, and that was a very big stigma for the person, and this has carries this stigmatization on the people. When you go to test, so many people, or even those who are sick, they don't necessarily want to say that they are sick of COVID, because of course people will say, oh, that person is sick, so don't get closer to him or to her. So that is a problem which is around. But at the same time, because it is also associated with all these Western politics and vaccines, so people want to try to, how will I say, to defy, the disease, and that is why you find that even when they put up measures of people are not very cooperative. Even if, of course, there are some other realities of survival, but I think they also want to show that, well, we don't want to go with it because we don't know where it came from, and we don't know the end of it, what they want to use it for. So you see that there is that kind of méfiance, as they say in French, that they don't want to go about all these measures. So it is a serious issue, of course.
Thank you, sir. Okay. If there are no further questions at this point, we'll go to our dear Dr. Eliza Inbal. Eliza is an innovation policy specialist with extensive experience building and strengthening international development innovation ecosystems. Eliza currently leads the PAIRS program for global innovation, which collaborates with the Israeli government, private and entrepreneurial sectors to develop policies and programs to transform Israel into an important source of innovation targeting development challenges. Eliza has been responsible for the design and launch of several innovative Israeli government programs to support Israeli technology innovation for development. Eliza?
Hi. So I'm actually not going to talk with that hat. And so I'll present to you my other hat, first of all, which is that I do a lot of work with the World Bank in terms of evaluating policies, projects, programs that the World Bank has. And over the past year, I've been working very intensively in Malawi, doing a review of pretty much everything that the World Bank does in Malawi that affects food security and nutrition. So we're going to talk with my food security hat today and not with my innovation hat. And so that's the first thing I wanted to say to preface. The other thing I wanted to say is thank you to all the presenters who presented such a great and accurate picture of the dangers that COVID presents for people's well-being in developing countries. And by giving such a good and extensive presentation, you freed me up not to actually go into a lot of detail about the impact of COVID, but rather to talk more about, well, what do we do about it? And in order to talk a little bit more about what do we do about it, I first of all, I want to focus and say I'm not going to talk about the health part of it. And the reason I'm not going to talk about the health part of it is because my bet is on, we're all betting on in one way or another on this, my bet is on the fact that, or on the projection that many, many, many more people are going to die as a result of the pandemic in developing countries from hunger and poverty related challenges rather than directly from COVID. And part of that is because so many people are on the brink of hunger in so many countries, and partly that's also because you're dealing with very young populations in almost all of these countries, which are also less vulnerable. If they're not less vulnerable to catching COVID, they are less vulnerable to dying from it. And so I want to focus on that. And and my last framing thing is I want to make clear that we all understand as a baseline what the scope of the challenge is that COVID presents to food security and to poverty in developing countries. And so we'll start with this concept of extreme poverty. Extreme poverty is people living under $1.90 a day. And if you say, oh, well, $1.90 buys a very different thing in Switzerland than it does in Malawi, this is true. But economists have something they call purchasing power parity, where they somehow find, like, they have a definition of what $1.90 is that they adjust for inflation in different countries, so that they make $1.90 into the same thing in Switzerland and Malawi. So without going into how they do it, what $1.90 represents is it represents the minimum amount you need to survive in terms of meeting your very, very, very basic needs. People who earn $1.90 or less a day go hungry. They don't starve to death because they wouldn't be earning $1.90 a day, but they do go to bed hungry on a regular basis. Moving up a little bit beyond that, you have less extreme forms of poverty where people might not be able to afford a nutrient-rich diet, but they're not in danger of hunger. So if we talk about there being about 750 million people in extreme poverty around the world today, or almost 1/10 of the global population, the estimates that have been given with regard to COVID and how that's going to impact that are that if you look at the estimates of the ILO, the International Labor Organization, they've estimated up to 140 million extra people going into extreme poverty. If you look at the World Bank, they're a little bit more conservative in their estimates. They're saying about 70 to 80 million. But regardless if it's a 10% increase or a 15% increase, these are people who are falling into a place where hunger becomes an issue. Now, I actually have a couple of slides which will help us a little bit understand what this means in order to understand how we deal with this. That is not the first slide I wanted to look at. The second slide is the first slide, I guess. Right? Can everyone see that clearly? Yeah. All right, so this slide does not exactly show what I want to show, but I want to explain what it means. What this slide means is what happens when all of a sudden a family, a rural family, we're not talking about urban families here, cannot afford to eat a balanced, healthy diet every day. And what happens, and so which is what many rural families are facing now. And in case you're wondering and thinking people on farms are less hungry than people in urban areas, that isn't the case. Over 3/4 of hungry people in the world live in rural areas on farms. So farmers, in a very ironic way, because they're so much poorer even than people who live in slums in urban areas, are generally more hungry than people living in slums in urban areas. So the first thing that happens, and this graph sort of shows it, which is why I stuck it up there, is that people start buying lower quality calories rather than higher quality calories. So Dr. Kishore talked about India, and he said that he felt that for India, the greater danger is not that people are going to starve to death as a result of COVID, but rather that people are not going to be able to afford vegetables, protein sources, I think is the bigger one, sources of iron, and so on and so forth. And this is something that in the United States and in Israel is also an enormous issue, because normally when we speak in the United States and Israel about undernutrition, we're speaking about that level of undernutrition not that people don't have enough calories, but they don't have enough nutritious calories. When you keep going down from there, what ends up happening is you see there's famine food use. So every country in the world which is dealing with hunger, it's not dealing with hunger for the first time. Because we're having now a global shock, but thanks to climate change and thanks to desertification and thanks to population growth and thanks to so many other things, many countries in the world are on the balance or on the brink very frequently between hunger and not hunger. And so when you're dealing about these marginalized countries, and some of them are countries of conflict or which have a lot of refugees and other ones are not, there's like a whole international system that's set up in order, like both nationally in terms of having grain reserves and food reserves nationally, and in terms of regionally, having regional food reserves, having the World Food Program, which is there and has all sorts of networks set up in order to feed people. So all of those emergency systems are now kicking into high gear. And the real fear about these emergency systems is it's not that we need to create emergency systems for emergency feeding where they don't exist, but it's that they're going to not manage to hit what's needed. We've already been in a bit of a food crisis. Now, for those of you who don't know, there's an enormous locust problem in East Africa, which even without COVID would drive up the number of hungry people hugely. And so that's one level of how we deal with it. The next thing that happens in poor rural families, so they've gotten whatever little amounts of food assistance and grains that they can get, and usually food assistance is calories, it's not nutrition, it's grains more than vegetables, as they start selling their productive assets. And that's where that's where you have a danger, that's where you get a red flag going up, because if I'm a farmer and I have a cow and I sell my cow, what I've sold is my ability to spring back from this crisis. And so what we're all trying to avoid is people who are starving getting to a point where the only way that they can deal with that starvation, or like with their new level of insecurity, is by either selling productive assets, or if you go all the way down further, I don't think it's actually here, because for women, the big vulnerability is selling themselves, or people selling their children. And that is a coping mechanism that is used. And that is widespread, and that we also have to think about. So in order to deal with those things, and to deal with the possibility of 150 million new people suddenly going into this, there is absolutely no way that we can deal with this without governments and without large amounts of money. And so I think that at first, like Micha was talking a little bit about how NGOs have to come in where governments are failing. The challenge is far too big for NGOs to hack it alone. And the only way they can be dealt with is through governments. And the only way that governments can deal with it is through social protection. So you'll be surprised to hear that or some of you might be, that even the poorest countries in the world have welfare now, have social protection. And what that means is that in the poorest countries of the world, and Malawi is the one that I know better than other countries, because I work there, and that's one of the 10 poorest countries in the world. The poorest of the poor have access to transfer payments. Every one of the poorest countries in the world have actually welfare systems of some sort set up that might not be fully adequate, and might not be perfectly targeted, and might have all these problems with it, but are there exactly to stop people from falling into that point where they're overcome by hunger, and they have no choice but to sell their productive assets in a way that they won't be able to spring back from it. And so the statistics at the moment is that 190 countries in the world have social protection, including almost all of the poorest countries in the world, for the specific reason that the World Bank and donor countries, that it is true in the 1990s and the 1980s said welfare is a bad thing, have woken up since then and have realized, and a lot of data has gone into this realization, that without being able to just give people money when they need it, we can't, the people who need the help the most are not going to be able to survive shocks. And a shock could be a flood, a shock could be a conflict, a shock could be food prices spiking, or a shock at the moment is Corona. So in a way, Corona isn't different for developing countries than anything else they've gone through before. They've been through this before, but it's, but in a way, it's like, so we're suddenly focusing our attention in all of these countries because everyone is going through the same thing to different degrees at the same time. And so I think that like what we're going to see right now is that a lot of these systems that were so important, that have been so important over the past few decades and have been recognized as such, of having social protection and insurance and one that I didn't mention, which I'm going to mention, could we move on to the next thing, is diversification of livelihoods have become even more important. So the next point I want to make is on diversification. So can we move to the next slide? Micha talked about remittances. And he also talked about the bad foreign corporations who come in and invest in these countries. But I want to explain to you how much that money matters. So if you look at this graph here, it only goes up to 2016, but you see different types of money coming in to developing countries and the impact it has. So if you look all the way towards the bottom, that's aid. That's how much money is coming in for aid. Some of it goes to NGOs, some of it goes from governments in developed countries to governments in developing countries. Some of it goes from foundations or UN organizations, but all of that money is the gray line, everything that we're charitably giving. The top blue line is how much is investments from companies in order to open up factories and things like that. It is true that factories are closing in developing countries, but not only factories from foreign investment, factories also locally, just like factories are closing everywhere. And then you'll see this blue line of remittances here, the bright blue line. Remittances in many countries is the most important form of income. In a lot of countries is the second most important form of income for poor people. And that's an enormously important coping mechanism, because if you, like, when you've lost your factory job, having a cousin abroad who has a job is something that enables you to survive until you can find another way. If you've lost, there's a famine or a drought in your, and as a result of which you've lost your crops, you need to have a cow, or you need to have a way of getting employment in a factory, or you need to have a cousin that has remittances. And I think that if there is one great threat that makes COVID different from the shocks that people in many of the poorest countries in the world are facing on a regular basis, it's the fact that it's like a quadruple whammy. That all of these different forms of resilience of, well, if there's a drought, well, then I can get a job. But if I can't get a job, then I can go back to the farm. But if I can't go back to the farm, at least I have my cousin who is sending me money. All at once are converging into one place. And I think that, like, when we talk about the way that governments and the international community, because if you look, for example, at Malawi, which does actually have social protection for all of the poorest people, like the poorest of the poor in Malawi, none of that money is coming from their tax base. That money is coming from, or actually 5% of that money is coming from their tax base. The rest of that money is coming from the World Bank and from different development banks and from different donors who are giving them money. So when we look at like what's going on with COVID, so on the one hand, we're doing emergency feeding in order to make sure people get out of this. On the other hand, where we need to look at, we're looking into this whole question of how much money can be brought successfully through social protection just to give people the money to survive. And then the third thing is that, hold on a second, so I don't lose my train of thought. We've got money, we have building resilience. And then the third thing is the most vulnerable to these temporary shocks, because COVID will end sometime, are children under the age of 3, because I can afford to be malnourished for 3 years and I will come out fine on the other end. If a child under the age of 3 is malnourished, that will affect his chances in life because his brain won't develop to the same extent. His chances of not surviving past the age of 5 are much greater. So those are like, if there are 3 pillars to what we need to deal with at the moment, it's emergency feeding, social protection, and nutrition of children under the age of 3 so that they will make it past this time and be able to flourish afterwards.
Thank you, Elisa. Can you say, we're going to open up for a broader discussion in a minute, but I'd like to ask first, can you say which countries have been already responding with emergency feeding and kind of like a robust response to these issues?
So I can't say, I can say that everyone is doing it. I can't say who is doing it better and who's doing it worse, because I haven't really looked into it, but I can say that every country has this. Because like I said, shocks, which of this is one, it's not a first time thing. Like for us, I think COVID is unprecedented, right? In terms of our experience in our lifetime. Major crises of this level are not unprecedented in any country. I mean, like you can think of the big ones like Haiti and like Haiti has gone through flooding, it's gone through droughts, it's gone through the earthquake, flooding and the earthquake and all these different things. Like any severely poor country is dealing with regular shocks that recur and recur and recur. And so a lot of these systems are already in place. Some of them work better, some of them work less well, but they're there. And the only question is like how we use these systems in order to get to the greatest amount of people possible in order to ensure they survive.
And how do we prioritize between addressing now these very urgent issues and then also addressing issues like the locust, like at the same time, there's the locust issue going on in South and East Africa, while all the regular issues of desertification and climate change are still going on. And so, how would you, like, the aid complex or the World Bank, how is it now prioritizing this response in relation to the rest of it, to its normal activities?
Well, I can tell you the way the World Bank works, and they've been doing this for a number of years. This is a fairly new thing, but it's not totally new. Every single project pretty much has in it a crisis fund, which is, it's like a bureaucratic thing and it doesn't really matter. But whereas before, if there was a crisis, the World Bank would have to go back and they'd have to sort of get approval from Washington in order to disperse more money in order to, like now, if the head of, like there are projects, the World Bank does projects, and a project will maybe be $100 million and it will tackle a specific vertical. So it could be about agriculture, it could be social protection, it could be about water, it could be like, there are many different types of projects, but the way that it'll work, or it could be health, of course. So a project will have all sorts of goals, like it will be extending social protection to a greater number of people, or it could be improving the livelihoods of smallholder farmers. The World Bank has also made the transition between supporting agribusiness to understanding that smallholder farmers have to be its main priority quite a few years ago. And in those projects, there is this facility that says in the middle, the moment that there's a crisis, we have the ability to reassess whether the stuff we're already doing in that sector is what we ought to continue doing, or should we be diverting resources to doing something different. And so in every project, they're sort of re-looking over the budget of the project and saying, okay, well, we were supporting agriculture, but I'll try to give an example. Working on nutrition projects. So we were supporting a nutrition project that was looking about long-term nutrition, was mostly about teaching mothers how to do, like, to more properly feed their children. But now we need to worry about emergency feeding. So we're going to take some of that money for teaching and we're going to shift it into emergency feeding of small children. So that's an example of the way that it's done. And so there's a lot of that going around. So in organizations that mostly do development work, like they're thinking more long-term about building structures to help countries progress long-term, then what they're doing now is saying, okay, well, we're going to have to temporarily divert some of those long-term resources to meeting the immediate need. And then you've got all these other organizations like the World Food Program, whose mandate is emergency feeding. And feeding of food insecure people. So the World Food Program, for example, also feeds people in refugee camps and so on and so forth. And here it's more a matter of, like, they're prepared for emergencies. They're not prepared for a global emergency because we've never had one in our living memory. And so, like, so now it's more a matter of thinking, okay, how do we take all the systems that we already have in place of dealing for emergencies and make it deal and scale that up, and where are we cutting and where are we trying to get more funds. And one other thing I do want to notice is that we're in the middle of, like, even before COVID, we were in the middle of an emergency of an unprecedented scale. And the emergency of an unprecedented scale is the displaced persons and refugee emergency. So we're already dealing with the fact that, like, we're dealing with an unprecedented amount of people who are enormously vulnerable, or not, as Ruth Messenger discussed in her presentation, connected to very strong, like, social, like, networks that can help them survive this. We're already often dependent upon emergency feeding, and we're even adding to those numbers. So there's a lot of, within prioritizing, of just trying to figure out how you either slice the cake more thinly or expand it.
Thank you. Any further questions for Eliza before we open up more broadly? I'd like to ask like a broader question. Maybe Eliza, you can relate to this, and perhaps Dr. Kishore. I was wondering from your presentation, Dr. Kishore, if it is your opinion that rural communities are actually in a position of, right now, a bit more resilience than the urban poor, and if so, can that be translated into policy somehow?
So, yes, in India, for two regions, rural areas seem to be doing better. One is the employment and income is more dependent on agriculture. And agriculture was one sector where activities continued even during the lockdown, right? The sowing, the transplanting, whatever it was going on. That's one. And second is the social welfare programs also focus more on rural areas. So, for example, this workfare program that I mentioned, employment in it has gone up by 40%, 40-50% compared to the same time last year. So for those two reasons, they seem to be doing okay. It's pure job and income side. One thing that I can say is that Indian government needs to be more generous, and it needs to broaden. So, for example, even the food supply, this 5 kg ration per person per month that is being given, I think it should be made universal right now. Anyone who queues up, she or he must need it. No one wants to stand up in a queue to collect their ration during this time. So I think making it more generous is something that seems to be a thing that Government of India should try. The Government of India, however, is worried about its fiscal situation and deficit becoming too large. I would think, I'm not a macroeconomist, but I would think that that's not something they should be worrying about right now. So more generous public support is what I would suggest.
Mm-hmm. Can a case be made that there should be more investment right now, or kind of and that policy should be made to encourage rural communities to stay on and find ways to strengthen rural communities in order to avoid, at this point, people leaving their lands?
So I think right now it's happening to some extent automatically, because urban areas, a lot of jobs and markets are yet to open fully. But I think it's not easy to do that in a short period, because, for example, in India, maximum number of intra-country migrants emerged from the two poorest and largest states, Uttar Pradesh and Bihar, right? And it's very difficult. And these two states, also what is happening is a lot of state governments are not able to collect taxes because economic activity itself is down. So one way that governments are trying to do is raising taxes on petroleum products. In India, in last 6 months, diesel and petrol have become expensive by about 20 rupees a liter, right? So that's how states are not in a position to spend a lot of money right now. And I do not expect them to come up with any generous policies, even if they should. So I think that is kind of unlikely. Yeah.
Thank you. Atman, you had a question?
I actually would love to answer the question, so.
I'm sorry?
I said I would love to answer the question or to give.
Oh yeah, go ahead. Yeah, Lisa, please.
So I mean, so the question is, how do we ensure that, that the idea of diversified livelihood is good, but how do we ensure that people at the bottom of the pyramid have diversified livelihood alternatives? Well, most of them have already sold their productive assets. And in other hand, destination countries have prioritized their own people on the jobs rather than foreign migrant workers. So I don't know whether it's specifically precisely true that most people have already sold their productive assets, but I think that Atma, you're talking about something which is the challenge, or the new part of the challenge of COVID in developing countries, is that sort of you have an all systems fail in a way. That from the perspective of people who, who may have had different alternatives for like in a desperate moment, and now all those alternatives are shutting down at once. And I don't have an easy solution for it. And as Avinash said, I think that like expecting extreme generosity at a time that everyone is in the same dire straits is also very problematic. And the problem about being extremely poor is that almost always your needs are last and not first. But I think that if I had to guess, and this is a guess, I think that there's the now, it's right now we're in the tourniquet thing of just like trying to stop, here's my hand motion, here's my tourniquet, of just trying to stop the hemorrhaging to the point where people survive the next few years. And there's no doubt in my mind that extremely poor people, after all is said and done with COVID, are going to be in a much more vulnerable place in 3 years from now than they were 3 years ago. And then we're just going to have to start rebuilding. Like, one of the things that's true about the past 20 years or so is that over the past 20 years, every single year, from year to year, we've seen extreme poverty be reduced to the point that from 1990 to 2015, we managed to cut extreme poverty in half, and almost the same, and in terms of percentages, the percentage of hunger in half. Avinash, I hope I got that right. But though because of population growth, we didn't quite make half for the number of people that were hungry. And we set for ourselves this goal for 2030 of eradicating extreme hunger and eradicating extreme poverty. But what's going to happen even after we've solved COVID as a health issue is it's going to take us quite a few years to get back to even where we were in 2015, not to even begin to talk about reaching the goals that we've set for us for 2030. Because there's no doubt this is an enormous blow, and it's nothing that there's an easy answer for. And all we can do is little by little start pushing that rock back up the mountain again.
If I can jump in here, Eliza, you seem still to, you say it's an enormous blow, but you still seem to embrace the same paradigm that somehow, and just to me, it seems like we now see that it's a broken paradigm. That relying on international trade and things like remittances it still remains, even if more people are eating a bit more and there's less malnutrition and so on and so forth, still the vulnerable populations remain extremely vulnerable. And when crises come, which they are going to keep coming, I'm thinking particularly of climate change. But there are others, it still leaves these same populations extremely vulnerable. And so I just want to push back and say that I think that we have to change the paradigm and have to say, not that there shouldn't be any international trade, or there shouldn't be, of course there should be, and of course there should be remittances as well, but that we have to prioritize building the resilience and the self-reliance within countries themselves, which was after the first period of decolonization, that was the goal of many countries, and then that changed. And my sense is that, I'd love Ruth, if you could, or Avinash, or anybody to come in and also give your opinion. But my sense is that this crisis pushes us towards a new returning to, in some way, to the model of self-reliance, at least in terms of food security.
I do have things to say about remittances, if not about, like, in terms of that. I mean, I think with food security, there's a balance, and there was a shift, like the pendulum swung too much to the we can just import food, but IFPRI actually has different opinions on that. But I do want to speak about remittances for a moment, because that's this crisis. Let's look at Haiti after the earthquake. Remittances were an enormously important survival mechanism. I mean, every time that you have a localized crisis, having people abroad that are there, like from your family, that can help send back things is enormously important. And remittances are important also in investing in local communities.
Right, of course. The villages we work in Nepal, they survive by remittances, but they survive also because there has not been investment, and there's not been a policy of investment in making them, making them food secure in and of themselves. The opposite. And my feeling is the reason that, Qatar or Saudi Arabia or Malaysia can pay people $200 a month or whatever it is because they're hungry at home. And if they weren't hungry at home, and if there were resources to transform these villages and make them more effective, that things would be different. And they wouldn't have to be 5 years without their family, without seeing their family, and then also vulnerable in this way.
So this is too complicated to get into at this point at any length. But I think Elisa's presentation was important, but I think that part of the point that I was trying to make earlier is that, absent a world in which we're going to give every single person their own 40 acres and their own startup funding, which is a nice dream. But absent that, some of this, really has to be tackled sort of country by country, area by area. So what's happening with the agriculture? The biggest issue that a couple of us mentioned, but briefly, I'm not sure I even mentioned it at all, but has to do with land. So one of the things that's going on in the world is that the land is being stolen from all of the people that we're talking about. So, do they depend on remittances? Do they have to be able to grow better? All of those are useful questions, but the first underlying issue there is land and water sources are being stolen, mostly by multinational corporations, with really, really ugly consequences, including murdering people who are there trying to protect the land. And so if you don't look at some of those underlying issues, then you can't really go country by country, area by area, community by community, to say what are the local strengths and resources, what's the best way to encourage maximum, which is really what you're talking about, maximum independence, but with broader structures to rely on. And I just want to reiterate, which the point which was made, but let's not neglect, because we see it so clearly now in the U.S. that with the U.S., I said this, but expose the racial disparities, the class disparities, but particularly the race disparities in COVID, and it's continuing to show. And, somebody said to me, I have no idea if this is true, but they named a particular state in the U.S., and it's like, why is the governor being so, ignorant of what's happening, and the numbers are going up? And I said, because for some of these people, the numbers are going up among Black and brown populations that are not the populations that they care about. And so nobody's going to say that out loud. The president comes, I'm sorry to say, close to saying it sometimes, but it's like, what's this pandemic doing? Oh, it's killing a lot of poor people of color. Oh, well, so let's just get on with business. So that, you can now see that in the United States in a sort of way that you don't see it usually, but around the world, there are very conscious, like, okay, if we impose a lockdown on the marketplace, who's going to get hurt? Some of the marginalized populations that we, the country, the grand country, see actually as a drain on our economy. So I just think the politics of this has to be, and I'm just saying that to say that I don't think there's a single national or global solution. It's really area by area, maximum independence, maximum listening to people, or what will help them create a situation that's a little safer, a little healthier, a little more equitable. And it's slow going, and we have no world forces that are interested in doing that, with, I think, the World Health Organization being one of those that is, Elisa, we have this discussion at a separate time, but the World Bank, although it's gotten better, has not been averse to making huge loans to huge economic development projects that ended up taking people's land or flooding people's land. they've gotten better about doing that, but it's still a world problem. So there's just lots. I'm just saying that this is such an important discussion, but all of us need to be doing more and more to look at root causes, look upstream for where the problem starts. And in the United States, it starts with racism.
Thank you, Ruth. Joe, question for Eliza.
Yes, since we don't want to displace governments in their responsibilities for social protection, what do you feel should be the role of private philanthropy in this mayhem?
Oh, good question. All right, may I ask for Jonathan, because you said there's one more question after this question?
Yeah. Jonathan also
Do the other question and then come back to me so I can have a moment to think about it. See, you've challenged me now. Now I've got a moment to think I need. All right.
Jonathan? You're muted. You're muted, Jonathan.
Unmute yourself. Oh, there you go.
Yes, sir. I want to thank and congratulate all the panelists and all the organizations that you represent that are doing indispensable work in this area. I want to talk about supporting those organizations. Yonatan and Micha, I've been trying all during this session to make a donation to Untitled Chapter, which I haven't done in a while, and the website is not responding. Maybe because we're busy with this, but I hope later today I'll be able, and lots of people will be able to do that. Based on the magnificent presentation that Ruth made, which she always does, I'm going to increase my contributions to AJWS. When I was the co-chair of the Young Adults Associates of AJWS in the 1980s, when I was a young adult, we thought that by now the American Jewish community would be giving dozens or hundreds of millions of dollars to AJWS. I'm glad it's 15 plus 3, but we have to double, triple, quadruple that as soon as possible. And we need to support all the tremendous work that all of you folks are doing. Ruth, you have to do something about the Torah and Jewish motivation and rationale material that's coming out from AJWS. Last Hanukkah, they published a thing saying we should identify with refugees because during the story of the Maccabees, Jews ran and hid in caves, which is kind of the opposite of the reason we have the holiday of Hanukkah and the understanding we've had for 2,000 years. So they need a lot of education, and I hope you will help them do that. Also, in terms of the land issue that Ruth very crucially raised before, when Micha was a roommate in my apartment 40 years ago in Manhattan, it was the headquarters of the Jewish vegetarians. And one of the things we need to do about land and water is try to convert people in wealthy countries and in poorer countries to stop raising meat and polluting and destroying the land. Anyway, Yasher Koach, and thank you to all of you.
Thank you.
And thank you. I remember your apartment very well, and the vegetarian energy there was amazing. You've done amazing things. Micha, I just want to say hello. Are you there, Micha, still?
I'm there. I'm there. And I was a refugee that came to Jonathan's apartment.
I know.
And we fed and cared for you.
We all hung out in Manhattan. But now you're all over the world and doing such amazing work. And we definitely support Table B'Tzedek and AJWS. And it's almost sad, you know, to hear what's going on all over the world, the starvation. And I was very moved that when a child below 3 years old, if they're not fed, packs their whole life. So we are doing all we can in Los Angeles to be of assistance. And my heart is broken, and I have such regard for the work you do. I'm at AJRCA. I'm the president there. It's a trans-denominational rabbinical school. But I say to myself, what am I doing? You know, I should stop that and just get involved with people who really knew it. You know, but teaching, you know, hopefully we spread other people who go out and work for social justice. But part of me envies your beautiful work. Thank you.
Well, Label Fine founded the Mazon Jewish Hunger Organization in New York, and then it moved to LA. Is it still going on?
Yeah. Mazon is, we have Sova, we have Mazon, we have several places, but it's terrible. The streets, you know, the COVID has spread, and the homeless, it breaks our heart too. There's so many homeless in Los Angeles, you know, and you know, it's overwhelming.
Micha, I have to go.
Okay, sorry, Ruth.
Okay, thank you, Ruth. Thank you so much for being with us.
Thank you, Ruth.
Keep up your fabulous work, Ruth.
Rita, you want to
Thank
respond
you,
to Joe
Jonathan.
before we end?
Thank you.
I think you wanted me to, yes. I'll be happy to respond.
Yeah. Then we'll end.
So I thought about it, and this is what I think. I think that, like, as a private, like, first of all, I didn't want to say governments need to do everything and NGOs shouldn't do anything, because I think that maybe the difference between, like, if you could put it in simplest terms, in an ideal world, where governments or large donors like UNICEF or the World Food Program can go wide, NGOs can go deep. And there's room for both, and both matter. And the truth is that when governments, and in a lot of times in developing countries or large international organizations, when they want to do something on a community level, and as happens in many governments, they don't have the capacity really to like, they don't have the network of social workers or whatever would be needed to do it on the community level, then NGOs can play an enormously important role in terms of that last mile of delivery of things. So I really didn't want to say in any way that, well, NGOs don't matter because really let the big guys handle it. NGOs are super important in terms of that ability to go deep. And I think that, like, when you look, for example, at what Tevel B'Tzedek is doing in Nepal, it's a really good example of how going deep can have a transformative impact on the lives of the people that you're working with, if you're doing it in a way that's long-term and responsible and data-driven and is empowering rather than disempowering. So, and in terms of, as a philanthropist, you have basically three options if you want to narrow it down in very broad terms. And one of the options is you can give to UNICEF or to large organizations, because when we were talking about these massive challenges, even the most massive organizations today need more money in order to address them. You can give to an NGO and then have the ability to see how your money goes deep for a smaller number of people. Or nowadays, sorry that I'm also mentioning this, but there are also a lot of platforms for direct giving, like Kivu, which enable you to actually say, I'm going to look into different, to giving directly to NGOs in developing countries, or giving directly to entrepreneurs that are trying to make a very big difference in developing countries. So you actually have a lot of options, and all of those options are good options as long as you do your due diligence and really believe in the organizations or the people that you're giving them to.
Good answer, Eliza. Thank you. Guys, we've run over 2 hours, so I want to thank all our speakers. Ruth has already left. I want to thank everyone here. Eliza, Lazar, Avinash, and Micha, of course. Thank you. This was mind-opening and heart-wrenching. And we hope to continue this platform in the future. I hope you can join us again for either one-on-ones or similar panels. And we sent a link for contributions, Jonathan, if you're interested.
I will use it immediately.
Thank you, sir.
Thank you, guys. Yasher Koach.
And to everyone, thank you for joining us and taking the time to think about these issues with us. Good luck to everyone worldwide.
Thank you. Thanks a lot. Good night.
Thank you, Jonathan.
Thank you.
Keep up your fabulous, fabulous work. You represent us in the toughest places.
Thank you, sir. So,
Thanks, Lazar.
Bye.
Thank you.
Night.
Thank you. Thank you. Thank you so much.